Good Wednesday afternoon and welcome to the National Healthcare Connect Fund webinar by MiCTA. Before we get started, I'd like to go over a couple housekeeping items. Please save all questions until the end. You can type in your questions by using the text box that is in the GoToWebinar launcher. That launcher should be on the right side of your monitor. This webinar is being recorded and will be posted to the MiCTA website by the end of the week. If you have any questions about this or anything relating to MiCTA after the webinar, please send your email to micta@mictatech.org. With that said, let's begin.
Good afternoon. This is Gary Green, the Healthcare Connect Fund and E-rate consultant for MiCTA. And this afternoon, we're going to go over the process, procedure, and information relative to how MiCTA members can take advantage of the National Healthcare Connect Fund program. First of all, the HCF program, Healthcare Connect program, is one of two sub-programs under the Rural Healthcare program. And the Rural Healthcare program was enacted into law by Congress in 1996 with the passage of the revised Federal Telecommunications Act. So HCF was created by the FCC in 2012, providing a more comprehensive broadband and consortium solution to the then rural healthcare program. Okay, it's now the advantages for our members. First of all, the HCP, the healthcare provider members, do not have to bid. That means they don't have to file in this program a Form 461, because by FCC law, they can use existing MiCTA E-rate discount MSAs, Master Service Agreement contracts, under the E-rate approved contract bidding exemption on the request for services on Form 462, which is the request for services, obviously. We're going to show you the actual document, the 12-150, and the area in that order, 150, that the FCC passed creating the Healthcare Connect Fund program. And in this case, specific reference to the exemption that they have deemed the E-rate exemption. And as you can see, initially the dialogue about the rules governing the schools and libraries program and HCPs and other public sectors such as municipalities and state universities are able to form a consortium under this HCF program. And we'll scan down, and I guess the real important part here is, if we go down to discussion at 267, you can see that consistent with their rules, the FCC, concluded in this order that an HCP entering into a consortium with E-rate participants and becoming a party to the consortium's existing contract should be exempt from the RHC competitive bidding requirements, so long as the contract was, competitively bid, consistent with the E-rate rules, which MiCTA does on the E-rate side, approved for use in the E-rate program as a master contract, and the Healthcare Connect Fund applicant, the individual HCP or consortium, is and does comply with all Healthcare Connect rules and procedures. So in order to take this exemption, advantage of it, for our MiCTA members, and by the way, they do not have to be an existing MiCTA Healthcare Connect Fund HCP member prior to the passage of this order. Any of the HCP eligible entities in the country can join MiCTA and take advantage of this exemption. So you can see where they say the applicant is eligible to take services under the consortium contract, and these are the two requirements, and the consortium contract was approved as a master contract under the E-rate program. So therefore, they agreed with MiCTA that such an exemption will reduce HCP's individual administrative burdens and encourages consortia, and likely will save universal service funds due to the lower contract prices associated with the consortia bulk buying. So there you have it. And in the forms, the exemption is actually in the forms documents. So that's where that exemption is coming from, right out of the order that the FCC passed. So now we're going to move on to the next slide. And as you can see, they must join, the eligible HCP must join before they file the 462. That's part of the requirement. Now, the first year MiCTA membership fee is waived if they're joining to MiCTA to take advantage of the HCF program. And MiCTA does provide assistance with form filings. I personally get involved in each one of the members who decide that they would like to file for funding under this HCF program. And we provide the proof of membership that they will have to upload in the 462 filing. And we also provide a document that says that you are using a valid MiCTA E-rate MSA. And all eligible vendors who the members can take advantage of under this currently are, and you can see the listing. And we provided the URL for means of convenience for the members and the vendors to be able to get into that specific page on the MiCTA website. So who is eligible to participate? Any nonprofit rural hospital with less than 400 beds, rural health clinics, as you can see, community health centers serving migrants, community mental health centers, local health departments or agencies, post-secondary educational institutions offering healthcare instruction, teaching hospitals, medical schools, skilled nursing facilities, and K-12 nurses stations, EMT stations at fire departments as part of a consortia constructed network, or a consortia of any of the above. Now, next slide, please. Here's what the program obviously encourages. HCP Consortiums, that's one of the driving forces of this program. And funding for this is 65% flat rate, and that's for any eligible broadband service, network electronics, and consortium HCP constructed or owned facilities. We currently have a member in Texas who is constructing a 363-mile fiber network that was funded under this program. Now you can see that the consortium can include non-rural HCPs as long as the consortium consists of one more rural HCP than non-rural. And in that case, the non-rurals also receive 65% funding. It also provides for ineligible HCPs, those are for-profit HCPs. They obviously don't receive the 65% funding, but they can take advantage of the discounted pricing on the services and equipment. And as the order states, they must pay their fair share of the cost for services and equipment as determined by the consortium lead. And who is the consortium lead? The consortium leader is the legal entity for the consortium. As you can see, can be a eligible HCP that is part of the consortium, an ineligible state organization, an eligible public sector government entity, including tribal governments, or ineligible nonprofit entity. So in essence, MiCTA could be a sponsor of a consortium in this program. Now the project coordinator, the real hands-on person, if you would, is the point of contact for the commission and USAC, the FCC and USAC under this program. And they're an authorized employee of the consortium leader. Consortiums can be made up of HCPs from anywhere in the country. It lowers the administrative cost. It provides collaboration of medical, technical, and administrative expertise through higher bandwidth at lower cost via MiCTA discount contracts that they would utilize. And then on top of that, they would get 65% funding under this program. And it enables telemedicine collaboration, lowers the cost of healthcare, encourages remote training. Now, what is supported? Wireline broadband services. There's no maximum to the speed of the broadband, if you would. It must be a minimum of 1.5 megabits. It funds internet access. It funds installation charges, and they are capped at $5,000 per location. It funds network electronics necessary to make your service functional. You must currently be receiving funding for broadband service, therefore for circuits, or filing for access circuits at the same time you're filing for the equipment. It funds connections to your offsite administrative offices, data centers, connections to research and educational networks, last mile, middle mile, backbone services, and leased equipment. There go the member that's building their own fiber network in Texas. And specific solutions for your networks. And as earlier stated, consortiums constructed networks, if that is the only option. So the eligible participants will be determined by Form 460, and each participant in the consortium, a Form 60 has to be filed for each participant in the consortium. And as we stated earlier, just reinforcing the 65% discount on all eligible services, network equipment, and customary installation costs for eligible participants. And they limit this 65% to rural hospitals with beds less than 400 or more are considered rural. And then the upfront payments for a consortium, they actually can be approved for 3 years under this program, so that they don't have to go back like our schools and libraries do in the E-rate program. They can actually be funded for 3 years upfront. As you can see, those multi-year contracts are considered evergreen, and the contracts can only be for 5 years. That's the maximum. Then we have to, and that's the reason why MiCTA goes, one of the reasons why MiCTA goes through this process every 5 years. Under the 462 funding window, there is a new process now that was directed by the FCC, and USAC now establishes when the funding window opens and closes. For this funding cycle that we're in right now for 2018, it opened on February 1st and it closes May 31st of 2018. Now here's a comparison. We spoke in the beginning that there were 2 sub-programs. The other sub-program is called the Telecom program. Now the Telecom program is only for individual applicants. You cannot have a consortium filing under the Telecom program. And as you can see in cross-reference there, relative to installation charges, both covered by under both programs. Lit fiber, yes, under both programs. Dark fiber under both programs. You can see upfront payments for IRUs, leases, and equipment. No under the Telecom program. Yes under the HCF program. And then you see connections to research centers. Yes for both programs. Connections between offsite data centers. Yes for both programs. When you get to upfront charges for deployment of new or upgraded facilities, that is not covered under the Telecom program. Only the HCF program. Constructed and owned facilities, not under the Telecom, only HCF. Eligible equipment, not under Telecom, only HCF. And the management and internet access, once again, not under Telecom, but yes under HCF. So you can see how robust the HCF program is in comparison to the Telecom program. So there are forms, just like there are in the other, such as the E-rate program, if you're familiar with that. They start with the 460, as previously mentioned. It's a data collection, informational collection form, and one of the things that they obtain there, of course, is the name, the address, location, and it also gives the reviewer the information in a consortium as it populates on the form for request for funding. During the 460 filing process and LOA, if you're comprised of a consortium that doesn't have full legal control of all the participants, and that's a letter of authorization, it must be provided. If you're a consortium where all the participants, as you can see, are owned and operated by a single HCP, the letter of exemption is what is provided at that point in time. And it addresses site information, contact information, eligibility information. That's where they qualify to make sure that you are an eligible HCP under this program. Certification and signatures of each one of those sites, HCP sites. Now you see the 461, which would be is the bid document. As you can see, that's not required by MiCTA healthcare provider members. So you bypass that process and you can go, once you fill out your 460s and created your consortium, you can go right to the Form 462, which is the funding request form. And once you've been approved for that, the funding window for this program is the same as the E-rate program, begins on July 1st of the funding year and ends on June 30th of the following year. And that's the invoice, the Form 463 you see there is the invoice document for disbursement of funding under this program. Under this program, relative to the service provider, once the 35% has been paid, whether it be a non-recurring charge or an MRC, a monthly recurring charge, once it's paid by the applicant, in this case the consortium leader, then the remaining amount is paid directly to the service provider by USAC. And you must make sure, the applicant must make sure that they have provided all of the invoicing 6 months after the end of the funding cycle. And now they've added, just recently added a couple of enhancements to the program. And as you can see here, consortium applicants can now submit letters of LOEs and letters of exemption to add the HCPs to a consortium without updating the consortium FCC 460s. They can do this by using a tab in the portal, and there is a portal for this. This is all done online for uploading information regarding if they are adding a new member or they're dropping an existing member, and USAC takes care of all of that data entry. And new site and service substitution, you can see in the middle of this funding process, if for some reason a site is closed or something happens to a site and they no longer are able to take service, then you can do a substitution, and there's a substitution button on the Form 462 that allows you to reallocate unused invoice funds within the comments, which means within the overview of the 462 that you originally filed and were approved for. And as you can see, any nonprofit public HCP in the country can join MiCTA, and here's the URL to join. And this tells you how to go over and actually fill out the request for membership. You receive an email confirmation, and you want to save that membership email for use with your 462 filing. But of course, once again, if you can't find that by the time you get to the 462, MiCTA will provide that for you. And then the MiCTA office contact information, my contact information, and the USAC help desk. And that's basically it. I know there will be questions generated by this, and as Nick had already pointed out, we will respond to those comments and make them available to everyone. That's it, folks. Thank you very much for participating.
And we'll go ahead and leave this we'll leave this on for probably about another couple minutes, wrap or get any sort of last minute questions in. And like I said, if you happen to think of any sort of questions relating to this webinar or anything at all relating to MiCTA, feel free to email us at micta@mictatech.org. But like I said, we'll leave this on for probably about another couple minutes, wrap up any last minute questions.
They can have access to the PowerPoint.
Yes, in the PowerPoint, or I'm sorry, in the webinar launcher that it's on the right side of the of the monitor, there is a tab, if you will, for handouts where it says 1 of 5. If you click on that to drop it down, there's a PowerPoint in there entitled MiCTA National HCF Program PPT or PowerPoint. You can absolutely download that, take notes, and do what you need to with that PowerPoint. If you need to review anything that was discussed, feel free to do that as well. All right, seeing as there are no questions, we will go ahead and wrap this webinar up. I'd like to thank you all for your time in attending today. And like I said, if you happen to have any other questions, feel free to email us at micta@mictatech.org. Thank you very much for your time today.